Hi there, my name is Jenna Sauls, and I am going to talk to you about being a child life specialist. So if you can give me just a minute to get my PowerPoint pulled up, and then we will get started. Okay, perfect. So as mentioned, I'm Jenna, and we're going to talk about being a child life specialist today. So first, who am I? My name is Jenna Sauls, and I am a graduate of KU, class of 2010, with a bachelor's degree in psychology. I went on to get a master's degree in child and family studies from the University of Southern Mississippi, and currently I'm a supervisor in a child life program in the Midwest. Previously, I held a staff child life position as well as a child life manager role at a hospital in Kansas. Today, I'm going to talk with you about the field of child life, what a child life specialist is, and if you're interested, providing you a glimpse into the day-to-day of this work and what you could look forward to if you pursue this as a career. Thank you for taking the time to listen. I hope you learned something today, regardless if you pursue the field or not. My contact information is listed on the last slide, and I am more than happy to answer any additional questions that you may have. Child life, what? So, as noted here on the screen, child life specialists are trained professionals with expertise in helping children and their families overcome life's most challenging events. We have a strong educational background in child development, and we're able to use developmental knowledge to help kids understand and cope with traumatic experiences. Many child life specialists practice in hospitals, but as the field continues to grow, there are child life specialists that work in outpatient settings like dental offices and child advocacy centers, as well as with kids who are on hospice care and through the court system. All of our work is rooted in play, as play is a universal language for children. All children play and use play to help them make sense of the world around them. So what does it take to become a child life specialist? So child life specialists are required to have a bachelor's degree in child development, child psychology, or other related fields. There are universities now that offer child life degrees, both undergraduate and graduate, as well as some universities that offer a child life specialty when working towards a development or family studies degree. There are certain courses that the ACLP, or Association of Child Life Professionals, requires you to have in areas like development and death and dying. The ACLP then requires a 600-hour clinical internship that is supervised by a certified child life specialist. Many hospitals across the country do offer these child life internship programs. The requirement to get the internship includes a certain number of volunteer hours working with well children, hospitalized children, and children in stressful situations. Many applicants also complete a child life practicum before applying for their internship. Once the internship is complete, there is a certification exam that must be passed in order to become a certified child life specialist. So if you're looking for additional information about the child life field, there are some. The Association of Child Life Professionals, or ACLP, is the best source of knowledge for any aspiring child life specialist. They're our governing body, and they make all the requirements to become a child life specialist, as well as maintain certification. You can visit their website at www.childlife.org to learn more information. Also, I am more than happy to talk with anyone interested in becoming a child life specialist. I personally took a bit of an unexpected course to become certified. I didn't realize I wanted to be a child life specialist until after I graduated college. So that required 2 more semesters of additional schooling and some time to get experiences to build the hours up required to apply for that internship. Everybody's path looks different to becoming a child life specialist, and I'm happy to share more of my story and help out anyone interested in pursuing this field or learning more. Okay, so what does a child life specialist actually do? I'm going to talk a little bit about the day-to-day, both from the lens of a staff child life specialist and very briefly about leadership in child life. I am going to talk more about hospital experiences, as this is what my background is in. But as I mentioned, as child life continues to grow and venture into all these different avenues, it's not going to look the same for everybody. So child life specialists provide what we call interventions to patients and families to help them cope with any needs or experiences they are having. This requires us to assess all situations based on a child's developmental level, temperament, family history and stressors, past medical experiences, as well as several other factors that influence a child's response in the hospital. We're part of the psychosocial team, which means we look at the relationship of social factors and individual thoughts and behaviors. Our assessment then leads us to our interventions. What would this family benefit from in regards to education, preparation, and support? Our interventions will look different based on the developmental age of the patient and their family, as well as why they are in the hospital. So for a more specific example, I'll talk about my time being a child life specialist in the emergency department. Most of my time was spent preparing patients for what was going to happen to them, whether that be they needed an IV start, they had a laceration that needed repairs, they were going to go have a CT scan, whatever it may be that they needed to learn about. If they needed an IV and never had one before, my job is to explain it to them in terms they understand. This could be showing them a doll that already has an IV placed, or teaching them about the different items that they'll see during the IV, like the tourniquet, alcohol swab, and tegaderm. I would then help them create a coping plan to help the procedure be as free from trauma as possible. This could be distracting the patient with an I Spy book or a tablet, cueing deep breathing for them, or encouraging them to count out loud or even watch if that is helpful. We also include parents in all our plans, as a pillar of our profession is family-centered care. This means we recognize and value the impact that a whole family has on a child's illness. For that IV example, a parent could sit on the hospital bed with the child and hold them in their lap to provide comfort during the procedure. For a child life specialist who works in an inpatient unit, or other words, a unit where kids have to stay multiple days, they provide education too, and they also work to normalize the environment to minimize any disruptions to child development. Many hospitals have playrooms and teen rooms for patients to get out of their hospital room to have some normalcy. It also encourages socialization, which we know is so important when patients are isolated from their friends and family. Inpatient child life specialists will teach kids with new diagnoses what is going on, and I have an example of that I'll walk through in a little bit. They can build schedules and charts to reinforce good behaviors like taking medication, and they can offer opportunities for therapeutic play. As mentioned, I will touch very briefly on my role as a leader in child life. In a leadership role, my job is to support the team in their work. I meet often with my team, helping them develop goals to elevate practice, work on new programming that would benefit the organization, as well as coach and give feedback to continue the growth and development of my team. I'm not going to spend a ton of time talking about this, but if you've always had an interest or are naturally drawn to leadership roles, I just wanted to make sure you knew that there's a place for that in this field. So, disclaimer, I have already tried to record this session and I realized that I cannot play a video and the sound come through. And I apologize for not being tech savvy, but what I'm going to do is I'm going to play the video and then just narrate it. Because I'm narrating it, I am going to say a lot of the things that I did say in the actual video, but I might also call out some of the behaviors that I'm doing just to help you truly understand what a child life specialist is. Obviously, I'm the one in brown in the scrub standing there, and then I have a patient and her sister sitting on the bed. Okay, so the first thing I would do is obviously walk up and introduce myself and also ask the patient what her name is. If you can see, I get down on her level because that's the least threatening position for a child. I explain that my job is to help her understand what is happening at the hospital. I ask if she's heard the word IV before and then explain it to her. An IV is a medicine straw that has a button attached to it that lets us give you medicine. As you can see, I'm showing her the object. Dolls are also great tools to demonstrate medical procedures and devices on. So we talk about the straw or IV and how it goes into her vein, or the blue lines that she sees on my hand that carry blood throughout her body, and how placing the IV is going to be a poke. We also talk about the steps. This will include the tourniquet being placed, cleaning the arm, how the IV is a poke, and then I give her a job. Her job is to hold her arm still during the procedure so that we can get that IV where it needs to be. But we also talk about how she can do fun things during the procedure as long as she can hold that one arm still. We talk about using a tablet and how she can play a game. Next, I introduce my nurse friend, Olivia, and explain that Olivia will be the one doing the IV while I will be playing with the patient throughout the procedure. I do hold up a towel to block the view. That's not always necessary because some kids do like to watch and that helps them be more successful. But this patient in particular wanted to have the towel held up. As I'm blocking the view, I will also explain what the nurse is doing. We talk about the tourniquet being a tight hug and squeezing her arm. We talk about the alcohol, cleaning the arm, how it might smell, and it'll be cold and wet. During this time, I also am engaging in play with the patient. So I'm calling out some of the things that I see on that screen, making sure that they know that play is the most important thing aside from holding the arm still. When it's time for the poke, I let the patient know that it is time and that their job, and it's really important to hold very still. Obviously, this poke is not real in this video. This is a dramatization. But once the poke is placed, then I let the patient know that we're going to remove the rubber band and also place a Band-Aid on the straw to help hold it there. Then we validate how they did during the procedure. If they held still, let them know how great of a job they did. So again, I'm so sorry that you couldn't hear it in real time, but really I just wanted you to kind of hear some of those words that child life specialists would use. We make sure to use language that kids would understand, but also language that isn't so harsh. We don't go around telling kids they're going to get shots. We talk about getting poked and explaining to the kids why they need that. Okay, so the next thing I'm going to do is demonstrate an activity that an inpatient child life specialist would use. So as mentioned, all of our work is based in play, and this is really a playful activity to help kids understand when they've been diagnosed with leukemia. So this is called blood soup. This would obviously be used on patients where their developmental level is more routed in play, so those preschoolers or school-age children, but we've also used it on adolescents as well. It's a fun hands-on activity that provides sensory stimulation and also education. This is one of the best ways for children to learn. Along the way, we would ask questions to evaluate understanding and clear up misconceptions. When I do the activity, I'm simply going to walk you through it without considering questions, just to give you an idea of how we can explain medical terms and conditions to kids in ways that make sense and that they can understand. So we would start by explaining what leukemia is. Leukemia is a cancer in your blood that makes it harder for your body to fight off infections and keep you healthy. It is important for us to treat leukemia so that your body can fight off illnesses. We're going to do an activity where we learn about blood and what makes up your blood, as well as how leukemia makes your blood different. Okay, so we have a bag, just a plain Ziploc bag, and then I have these items listed on the screen. Obviously, they're all food-related items, but these are going to symbolize different parts and different matter of blood. So we're going to start with syrup, and syrup symbolizes plasma. So plasma is the liquid part of your blood, and it helps your blood flow smoothly throughout your body. So I just have some syrup here, and we pour it in the bag. Okay. As you're pouring that, next we will talk about red blood cells. And red blood cells are symbolized today by hot tamales, usually by red hots, but I couldn't find any. But red blood cells carry oxygen and nutrients throughout the body. So we have those, and we would add them to the bag. Obviously, we would let the kids do this if they wanted to. We could add it as well, really whatever they're up for and want to do. Okay, and then next we talk about healthy white blood cells. Healthy white blood cells kill germs and fight off infection. And these are symbolized by marshmallows. We'd add those to the bag. And then next, rice. I see I have rices on the screen, just rice, singular. But rice symbolizes platelets, and platelets form scabs and help stop bleeding if you're hurt. Add that on. Okay. So this is what makes up healthy blood. This is blood without leukemia. Plasma, red blood cells, white blood cells, and platelets. Okay. The thing that makes people with leukemia's blood different is something that we call leukemia cells or blasts. And they're white blood cells that didn't form the right way and are unable to perform their job. So we use medicine to fight off these bad white blood cells or leukemia cells. And they're represented by lima beans. And we would just pour that right in as well. This is everything that we would add to it. We would then seal the bag so it doesn't spill. The reason we use lima beans in place of leukemia cells is they do kind of look like deformed marshmallows, and marshmallows, if you recall, are our white blood cells. So it's also a visual representation of the differences between the cells for kids. So once that's added, we would then ask patients, or if their brother and sister are there with us too, if they have any questions, if they can teach back to us what's in this bag. That way we can really make sure that they understand what is going on. Then we would leave the bag behind so they can play, like I said, nice sensory activity. But also if they were to have other family members come visit, they could teach family members what leukemia is using this example. Ready. So I also want to talk about the realities. I don't think it would be fair to talk about my job if we didn't acknowledge there are some hard days. Unfortunately, there are kids that don't get better and there are kids that die. But the silver lining to that is that we are there for family during that time too. We can offer memory making, and we help parents explain to siblings if they don't know the best way to let a brother or sister know that their brother or sister is not going to live. There are also days that we see the ugliest of human behavior, and those days are hard too. But the great thing is, good days far, far, far outweigh the bad. And there's always a team of people there to help support you. So helpful tips. This is really more just talking about life and careers in general. So I encourage you to explore. As I mentioned, I got out of college and didn't even know what I wanted to do. There are so many opportunities out there, so many different things to do. So I really encourage you to explore all opportunities. Put career counselor on there because I actually met with a career counselor to find my job. Not to keep repeating, but not knowing what I wanted to do in college, I did go meet with a career counselor at KU, told her about my psych degree and my interest in working with kids, and she helped me find the child life field. And then don't assume you know where you'll end up. Be open to opportunities and things that present themselves to you. It's a beautiful journey to figure out what your calling and passion, and I encourage you all to take time to do so. So with that, I just want to say thank you so much for taking the time to listen to my presentation. I'm so glad I had the opportunity to talk about child life and the wonderful career that I have and love. Even if you aren't interested in pursuing, I hope you remember there is such thing, because if you're ever a parent or an aunt and uncle or a grandma or grandpa, and you have a relative that's a child that has a healthcare need or a complex medical issue, they could really benefit from child life services. Almost all children's hospitals and many hospitals with pediatric services have child life specialists. And I truly have only scratched the surface of all the great work that we can do. That's why I have this little picture on the screen, because child life specialists really do wear so many hats. We teach, we advocate, we encourage, but we're also there to play and normalize and assess the situation. So many different skills go into our job. I also wanted to mention there are child life specialists that work in adult hospitals. So if you are a parent yourself and end up with a medical diagnosis or some sort of medical issue, there's potential that a child life specialist is there to help explain that to your child. We really do all sorts of things. As I mentioned, I am more than happy to discuss further if you have additional questions or need help. My email is listed here, jenna.sauls@gmail.com. Please feel free to reach out with any questions. If you want to connect and learn more, I'd be more than happy to talk with you. Again, thank you so much for your time. And as always, Rock Chalk Jayhawk. Thank you.